Welcome.
Welcome.
Welcome to Empower Mundo.
Yes, I'm Dorina.
And this is, and I'm Diana.
And we're with Bledsoe Power.
And we have a special guest today, Dr.Noe Vargas.
Yes.
Hi, welcome. This is my first time on YouTube.
Yes, and Instagram and Facebook. So
Yes.
Oh, wow.
we are a couple of different platforms.
Right.
But we're really excited. So Dr. Vargas, he is an amazing individual in the field of behavioral health.
Yes.
He's an expert at what he does. He's also the assistant dean for the College of Humanities and Social Sciences at GCU, Grand Canyon University out here in Glendale, Arizona.
Yes, which is where we're at. So big thank you to you and GCU for allowing us to come here and getting more resources out to people about mental health. A little bit more about Dr. Vargas is he's also a licensed behavioral health professional, which is one of the reasons why we thought we should get connected with you and talk a lot more about ways to support the community, especially talking about Spanish-speaking communities or those that are underserved or underprivileged here in Arizona. So just another recap, we're out here in Arizona for anybody that's tuning in out of state. It's going to be an Arizona topic. We hope it's educational for you.
Yes, and also Dr. Vargas, he's very well versed in dealing with trauma and understanding like the neuroscience behind it and what happens to your brain, what happens to you physiologically as well. So we're gonna get a little bit into that, and that's something that's universal, whether you are in Arizona or if you're in España, wherever you're at, overseas, wherever you are.
Saludos a la madre patria.
Yeah. So we have some of our followers from all over the world. Some are in Germany, Brazil, where do we have? Colombia, everywhere. So if anything that we say here strikes a chord with you or you can relate to, message us, comment, let us know. And if you have any questions, feel free to write them down. I.e., write them down, like put them in our live feed, and then we'll read those.
It.
Yeah, text us.
Text it. So before we start jumping in and hitting you with all these questions, all these good old questions, we wanted to talk to you guys a little bit more about Empower Mundo and the reason why Bledsoe Empower, which is Dorina and Diana Bledsoe, created Empower Mundo. So this is something that we created because we understand mental health does not discriminate. From any age, background, socioeconomic status, it does not discriminate. So we wanted to empower el mundo, empower the world, and allow people from different backgrounds to, have a platform to promote mental health and awareness. So if this is something that's interesting to you, whether you're a mental health professional or maybe you're somebody that has recovered from certain things like addictions, addictive behaviors, trauma, you're a survivor yourself, we'd love to have you here to have a platform to talk more about mental health and reaching out to others. Because the one thing we did talk about a lot is knowing that you're not alone.
Yes.
And this is one way to really validate that.
That's important.
Yeah.
Absolutely.
Yeah.
So, who is Dr. Vargas? Do you want to give us a little bit of a background, where you're from, your education, and what you're currently doing?
Well, thank you for inviting me, first of all. I'm really honored that you guys invited me to talk a little bit about mental health, which is, a passion of mine.
Yeah.
And so I'm originally from Mexico, Nayarit, Mexico, which is south from Arizona, very south.
Yeah.
I came to the United States in 1989 when my whole family immigrated here. So I am an immigrant by definition.
Yeah.
And I actually I always wanted to be a professional, I always wanted to be in school and academic. I love academia, I love scholarly work, but did not know I wanted to be a therapist, I had to say that. That's kind of came as a calling to me, and I don't have time to go into details of that, but then I went to school, I went to Phoenix College, I went to Arizona State University for my undergrad, went to Ottawa University for my master's and my certification on trauma also. And then I went back to ASU for my doctorate in behavioral health. And then I was blessed to obtain a job at GCU as a director of counseling at that time.
That's awesome.
And after a few years, I got promoted to assistant dean, and now I oversee psychology programs. All the mental health, behavioral health, psychology programs are really under my wing, per se. And so I am blessed to, I had done private practice until last October. I actually had a private practice, but I needed a self-care, so I'm taking a whole year off, sabbatical on therapy.
Self-care.
Well, listen, don't trust a therapist that doesn't have a therapist.
Okay.
We all need one.
Okay.
But that's really awesome. So, because with having your own practice, that takes quite a bit of like steps in terms of like education and with getting licensed.
Yes.
So for you, right now you are a licensed professional counselor, that's a type of license that an individual would need in order to open up their own practice, and that comes with years of actively practicing and receiving supervision.
And
So
education, constant monitoring of your own practice. You have to have somebody who's been doing it for a while to say you're ready. You're ready now to treat independently.
Yeah.
And that's pretty major. It's a huge accomplishment.
Well, I'm blessed. I'm also a supervisor for Arizona. I'm a qualified supervisor.
Yes.
But
So you can give supervision to
I've done supervision, yes. I've done supervision.
DrNoe and I are both licensed associate counselors.
Oh, wow.
Yes.
So,
I did not know that. Disclaimer.
but now that we know, that's awesome. Okay, cool. So then, with being the dean,
Assistant.
the assistant dean, which is also
My
really
boss
amazing.
Which is amazing.
He's like, let me correct.
My boss when I to hear that.
Okay, assistant dean. What type of populations do you typically work with now?
Well, at the university, we have a diverse body of students. So we do have immigrants. We have refugees also. We have people born in the U.S. But I work with diverse populations: African American, Native American, Hispanics, whites, of course, who are maybe from what we call minorities within the microculture.
Right.
So I work with a diverse population of students.
Yeah. Very cool.
I am blessed because I learn a lot from them.
That's right.
Yeah, I learned so much in my classes. I tell my students that day that you think you know everything, that's the day that you probably need to be sitting by God,
Yes.
beside God, because
Right.
I just learn a lot from my students.
Yeah.
Yeah.
It's so interesting because, I mean, just to kind of go on that point, you can get as much education as you can possibly get, and there's still a lot of room for growth and a lot of room for development as an individual, right? So within your scope, like what areas within being a licensed professional counselor, what areas do you tend to focus in terms of expertise?
So I became specialized in trauma about, I'm not sure, like close to 10 years ago, I think.
Wow.
Because I started working with unaccompanied minors, children that were crossing the border on their own, trying to get reunified with their parents, refugees, minor refugees and adult refugees. So I started seeing a lot of issues that I felt like I was not prepared for. So at that time I decided to go back to school and get a certificate, advanced certificate in trauma. And trauma at that time was barely coming out. Now everybody talks that they're trauma experts.
Right. EMDR.
And but
different things.
but at that time there were just few universities who actually had that program. I actually opened a program here. Now we have a trauma program here at GCU. That's my baby. So
You're like, I created that.
That's mine.
It's important to me. Yes.
But again, at that time there was just not a lot. There were some coming up, but I felt like I needed training, and so I became specialized in trauma. I also have training in substance abuse. I'm an associate licensed substance abuse.
That's awesome.
LASAC, I'm not independent on that one, but I have training, and so I'm passionate about being an immigrant myself. I'm passionate about helping people who have gone through the process I've never been a refugee, but I've seen similarities in situations, and a lot of the mental health issues are very similar.
Yeah.
And so, however, I do families, couples, you know, and a lot of anxiety that I deal with.
Yeah.
So.
Well, and then when you talk about, you know, the Spanish-speaking community, that's the number one thing that you see is ansiedad, right? Nerviosas, you know, me pone nerviosa. And it's like, that's the baseline versus saying, I'm anxious, right? Or I'm struggling with anxiety. So you brought up a couple good things about, you know, being in mental health, there's a lot of stigma and there's lack of awareness and insight about what's going on. And to be a mental health provider and still feel like, you know what, I need more training.
Yeah.
You know, what does that say about the population themselves? That means they're really lacking knowledge and awareness. So for those that are tuning in, this will be kind of like a gem for you.
So, and also, to go off of that point, maybe we should set some clarity on what exactly trauma is and how you identify a traumatic experience. So how would you define trauma?
So I have a very simple definition that I don't know, maybe someone else had it, but I haven't seen it like that. I just see it as interruption of a normal development, a normal human development. So what I mean by interruption, I mean by an event. Now, an event can be what we call a traumatic event, meaning that we might define it, oh, that's traumatic. You had a car accident, you had, you know, some type of violence, witness violence or received violence, but
physical, emotional, any type of abuse, yes.
But then I have that traumatizing event, which is that even though I had an event that it was traumatic, I actually was traumatized by the event. Not everyone that experiences a traumatic or witnesses a traumatic event gets traumatized by the event. So it's important to understand the distinction between, so people won't be using the word trauma as they use the word headache, which is really the lack of knowledge on the issue of trauma. And that's why when people say, who should I go for a trauma therapist? I said, ask them about the background in trauma training. Because people may say I do trauma work, that doesn't mean they know how to do it. You know, and that's not to offend anyone, because I'm pretty sure everybody has a good heart and want to help, but wanting to help alone is not enough. You have to know how to help. And with trauma, and again, that's my passion, I'm very jealous of that, is that you have to really know what you're doing.
That's right.
You know,
That's right. Yeah. Well, you put someone at risk of their condition worsening when you say, I know about trauma, but I don't know how to treat it specifically, or this particular issue, we need to have this type of trauma-focused CBT approach versus an EMDR approach, right? So I like that you're bringing that up, because it is really important.
So with trauma, there's different type of experiences that we go through in life that we can deem either it being like a little T trauma or big T trauma. Which little T trauma, that can be something that had an impact on you, but it was not to the point to where it's debilitating. So maybe experiencing, maybe seeing a car accident, but not physically being in that. When you see that car accident, that can trigger some emotions, that can trigger some emotions inside that maybe we haven't processed yet, which can bring those up in that moment. Big T trauma can be
big T. Little T.
Big T trauma can be us physically being in that car accident and it having an emotional impact on us, which is going to be more debilitating. Man, that's a tough word. Debilitating for us to be able to continue with our daily activities, right? So it's really important to understand what it is that you're experiencing. So what would be some behaviors that you have either seen or that you are aware of that individuals can look out for if they have just gone through an event that they're not sure if it was traumatizing to them, or what exactly does that look like?
Well, I just want to address a little bit about that small T and big T, because I understand the debilitating part, but it's important to understand that if you have sensations in your body, whether you remember of a memory, whether it be a big or small trauma, that means that has impacted you. And that will have to be processed at one point whenever the person is ready. But one of the biggest behaviors is the hypervigilance
Yes.
of an individual, and that is when we start talking about neurobiology of trauma, which we don't have time today, but people become hypervigilant after an experience, you know, and like you mentioned, if someone went into something that maybe was small, but they feel like I'm okay now, and they can move on and kind of maybe remember that, even maybe not, then you probably won't have any of the hypervigilance. But if someone really got traumatized where now the limbic system got involved, the brain got involved, then the person's gonna be hypervigilant. So if at one point you might get triggered by a person, a smell, a color, a shape, because that memory went into your brain and it will be triggered by any type of situation, no?
Right.
And
Right.
so we call that we have memories, and we call implicit memories versus explicit memories. The implicit memory is the one that gets triggered by, and we're talking about when you said big traumas and big T. I don't use that language, so that is,
Little T's and
I
big
use
T's.
I
Yeah.
use simple complex trauma.
Yeah.
So that's
Yeah,
I'm
that's
trying to
it.
use your language. So I'm having a hard time with that, but we see a lot of simple traumas and complex traumas more in childhood, you know, as a child is developing, and that's what I'm talking about, the interruption that, like I said, that's how I use, and I don't remember where I got that from, maybe I got it from somebody, but, and so, unfortunately, those unprocessed memories do not go away because you think you don't remember them.
Right.
Because explicitly you don't remember them, but the brain does remember them implicitly, and that's why as an adult it always starts coming out.
Yeah.
You know.
And so, what when listening to you say that, like your body remembers it or your brain remembers it, what I've learned is that your body reacts first, and then your brain makes sense of it. So in those moments, like if something is triggered in you, what would be some physiological sensations that maybe we'll feel in our body before we even understand what is happening in that moment cognitively?
Okay. So when you said that your body, I don't understand that response first. You're talking about after the trigger event that
Yes.
something like she would kind of talk to me something like that, and then I say, oh, this happened because of that.
Yes.
That could happen in explicit memory, but in implicit memory, you want to have an idea as to why you responded. But some of the behaviors you said,
Yes.
a lot of fear. You know, there's fear. Then sometimes not understanding why you have fear. Fear that something bad may happen. That's related to anxiety also. Some depression. Unfortunately, suicidal ideation sometimes get involved because there's things that happen. But something that is very, very dangerous is destructive behaviors. Attempting to self-destruct, not necessarily by cutting or trying to commit suicide, but by doing risky behaviors.
Right.
And sometimes if there was sexual abuse, the behaviors tend to be related to sexual abuse, which is very dangerous. And the other one that comes, I just actually gave a talk on this, the association between substance use disorders and trauma. There's a big link between both of them, and there's always the chicken and the egg question here. I don't know if you're gonna ask like which one do you treat first. I wonder if they want to ask that, but
I've
it's
seen
like-
a lot of questions.
people ask like which do I treat first, the substance use disorder or the trauma, you know, and I would say it depends. It depends on your clinical judgment. I have worked with both, and I usually tend to treat the one that I discovered first because I feel like the other is an underlying issue, and so I go with that. So behaviors, they're different, and that's why it's important to understand something. That when you work with a trauma victim, what you're gonna see is the iceberg, and the iceberg is those behaviors, and you can miss the boat big time if you don't do a good assessment. Sorry, I'm starting like preaching here, but
No, we like it.
Look, I'm seeing a bunch of stuff coming up
you
too.
can miss the boat big time, and a good trauma therapist will understand that they need to do a good assessment,
Yes.
try to understand before diagnosing anything.
Right.
And this is what happens with children, and I think I mentioned this before, they get misdiagnosed a lot of times because people see the underlying, the behavior, not the underlying cause. And so as long as you don't treat the underlying cause, you're gonna be misguided by the behaviors.
Yes.
And
Yes.
so it's so important.
Yes.
Sorry if I went around.
No,
it,
no,
but
no.
Once I start talking about this, it's like I get my adrenaline going.
Yes,
I'm
'cause
gonna
you know
come
it.
Don't worry, that's how we get on live. Whenever we do our live videos, we're like,
I'm gonna come
and
down.
then there's people in the
No,
back
no,
like,
you're okay. You're doing awesome.
yeah. Well, and this is good information too, because I think oftentimes people have this misconception of what trauma looks like, and it's really hard to say, is this person violent because they're angry, or are they violent because they're having a flashback? And how can you decipher between the two unless you're trained in it? And so, it's really good to spread this type of knowledge because, a lot of us have those little T's or the simple traumas, right, that are a part of la vida loca, right? It's just a part of it, like a bumper to bumper accident. For me, that's a little T, but somebody who probably has social phobia, right, they have social anxiety, that could be a big T to them, right, a small bumper to bumper. And so it's really important to talk about these things because some of us might be walking around carrying a lot of little T's, right? Simple traumas, and not really recognizing that it's a big T or a complex trauma that we need to sit with a professional and really talk more about. So I guess my next question is, if I want to know more about what's coming up for me, what can I use? What are some resources that I can look into to really learn more about, am I suffering from something traumatic? Am I traumatized, right?
Well, that's a very good question because we have to be careful. When we talk about resources, I always talk about connecting the person to a professional who can at least give him a session of psychoeducation and trauma.
Yes.
That's another big part of being a trauma therapist. You have to educate before jumping into the water. You have to build a bridge, so that they feel safe.
That is beautiful.
And I think a part that goes into that is like when you are working with someone, having like a healthy and effective coping skill once you are digging into the trauma that we can always go back to practice grounding.
Yeah, I remember, I'm not gonna break any confidentiality here, but working with a particular client, I don't remember the year, the name of the gentleman.
No hip violations
up in here.
But I remember this particular one because she has chronic trauma, complex trauma, and this person had walls of protection against, being hurt, that it took me about 4 to 5 months just to break through those walls, to be able to build safety. Now you may say, well, why didn't you transfer her? You were not building momentum, you were not connecting. It wasn't about connection. It was about the damage that this person had endured in his or her life that learned to protect, but what was the key? The person kept coming back, kept coming back. And so it was like a tug of war until the person decided I feel safe enough to let you get in.
Yes.
So I didn't go into the trauma history until later, months later. So we had to build a safety net, and I don't ask people to read because then they self-diagnose.
Yes.
That happens to me when something
WebMD.
I'm reading and
oh
my God, I have this.
I've got so many disorders, medical conditions.
And so
I'm done tomorrow. Like it's
by connecting them to the right resources, to the right professionals, that means you may do some digging on the profession you're referring to, which I do constantly actually.
Yes.
So.
Yes.
And there's different assessments depending on how, depending on the level of trauma that you've experienced as a child, and of course as you chronologically age. That's going to have an effect on how you behave within your relationships, with how you treat yourself, and family members. If you're able to build healthy relationships, or if the majority of your relationships are toxic, right? So all of that does play a part. So if that is something that you're worried about, or you're noticing you're having a difficult time with living a healthy lifestyle, and coping with stressful situations in a beneficial way for yourself, then like Dr. Vargas said, the first thing we need to do is contact a professional who can provide you that support in a clinical setting and who can evaluate you and get an idea of exactly what it is that would be helpful for you and what your needs are.
Yeah, best thing that you can do to help yourself is to allow others to support you when you don't feel strong enough to support yourself. And I think that comes up a lot in counseling. You know, I'm finally here with the counselor. I'm finally here talking to you because I don't know where else to go. And that's a scary place for people to be, you know, and for them to be so vulnerable enough to share a piece of their story, including trauma, you know, that's frightening. And so we want to normalize this type of experience because it's effective. It's the stuff that we do actually does work in terms of, you know, the counseling piece, the assessing piece, getting you connected to resources. The stuff is there's a lot of data that shows how effective it is. So if you're wandering around feeling lost or confused about your own health, get connected, reach out to a professional.
Yeah.
And I have to say that, you know, my experience treating sexual abuse victims, when you trigger something, not personally, but
like a memory?
professionally. No, yeah, in my experience as a professional, that when I have worked with adults already who were victims of sexual abuse, one of the, I want to say, symptoms that I have seen is the lack of healthy relationships in their lives. Like how many times they have had relationships.
Yes.
Usually, I remember working with a Marine at one point, and going back, it was about his third divorce, you know, and so I went back and did a history timeline with his life.
Yeah.
And he like opened his eyes and he was like, no one has ever shown me that. Yes. And I basically said, if you don't deal with your trauma, the forced marriage probably, I mean, there's statistics already about remarrying, so this is not new to me, that I'm giving you any new data, but what I'm saying is that I have seen that put that connection.
Yes.
You know, and I'm not saying that's science, I'm saying that's has been my experience providing therapy to adults who have had sexual abuse as children.
Yes.
You know, and so it's damaging. I mean, it does damage.
It is, and even, you know, other types of abuse, like physical or emotional abuse, if we grew up in a house and our parents argued all the time, and then they got to a point to where it was physically abusive, even if it wasn't directly to the child, as we grow up, that is the idea of what we have a relationship is supposed to look like. So that's what we're going to seek, right? And another layer is added on top of that if we also were the recipient of that type of abuse. Right. Especially if it goes, like as you mentioned, he got older and it wasn't processed, it wasn't even conceptualized as to what exactly the patterns looked like.
Yeah. It wasn't a part of his reality at all.
No, because again, it's an issue of there was something lacking there. There was the person is looking for, but the pain again. Once you tap into the pain and make him realize that this is gonna hurt too. So the first thing you have to educate your client is that this is not gonna be easy. Maybe.
Right.
So and trying to understand, you need to stop seeking anything outside of you and work about you. You work in your trauma, and then maybe you can find the healthy life that you need. And there's research on it if you want to read about attachment theories,
attachment
styles, and I mean there's a lot of if you're a professional and want to read about that, there's actually a connection between the adult personality with the child attachment style.
Yes,
it's very, very interesting. And there's just a lot that neuroscience now is showing about. You were talking about, I don't know if you said violence or crime, but there's research showing of people who have been in prison who had trauma versus the one that didn't have trauma,
right?
And comparing the brains and look at the differences in the brain. I mean,
like
neuroscience is just now bringing a lot of more light to this issue of trauma.
Yeah, and there's even ways that you can go like get a CAT scan.
Right.
And depending on what places in your brain is firing, that will be associated to the amount of trauma that you've experienced.
Yeah.
So there's even ways that you can see that on a CAT scan, that it's clear. Yeah. It's very, very clear.
I've read an article about childhood trauma in the brain, and they had 2 CAT scans of I want to say it was an 11-year-old male with trauma, physical abuse, and one without. and the patterns were much darker on his brain in comparison to the child who had no trauma.
Yeah.
So it not only can affect your relationships, but it actually has a physiological effect on you too.
And we mentioned this about prenatal trauma, right?
Oh.
That's the other
In
thing.
the womb.
And even before the mother gets pregnant, if the mother has experienced trauma, there's evidence that shows that the traumatic memories or the damage the mother had can be passed on to the child. And there's a lot of a new research on what's called epigenetics, which is trying to connect the genes or it's not the genes as genetics, it's the alteration of the gene when issues with trauma, and then now the marriage of the environment, because sometimes the mother might have experienced trauma before or during pregnancy, and then the environment still traumatic or traumatizing. And so there's this marriage, right? And then epigenetics kind of look at that. How is this impacting the brain of the child? How is the memories? How are the neural pathways being connected? And this 11-year-old, what neural pathways does he or she have that have the memories of the trauma in there? And maybe some of the behaviors that we say, well, this doesn't child behave this way, and we're giving medication and the medication doesn't work. Well, you may be treating the wrong diagnosis here.
Right. No, for sure.
So there's just a lot about trauma. That's why I'm passionate about it, because it impacts so much. It makes people suffer so much that for me, when I became passionate, and I have so many stories I could tell you that really touched my life. Now, as a professional, I am well trained to be able to separate and not take it personally. But I'm able to. I remember how it impacted me, saying like, "Wow, this must be really hurt."
And that's very empathetic.
Yes, it is.
Of you.
I mean, I'm grateful that when I was working with these kids and everything, like I forgive my parents for not getting my bicycle that I wanted, for not getting the candy I wanted. I mean, like,
it's therapeutic for
oh
you
my
as
God,
well.
I was like, my childhood was good.
You're like, oh my gosh.
I was like, no more candies or anything. I forgive you.
That's how I had to. I was always grounded in high school, like literally all 4 years.
Oh God.
But it was really my own doing. Like my parents were great.
Yeah.
But it was like I did it to myself. But I had to be like, oh. I did it to myself. I forgive you guys for never giving me a phone in high school.
I think forgiveness is a big part of trauma too. And you brought up something about pain, and it brought up one of my clinical supervisions I had with my other clinical supervisor, and she talked about how when we avoid suffering, it brings on pain. But when we're willing to suffer through the moment, like our traumatic moments, and look at it, that's when we're able to live with pain and know how to manage pain. And so I think with talking about trauma and just putting that into perspective and seeing how powerful it is, and how if you're uncertain about what's going on, reaching out, how imperative it is to reach out to somebody who's trained in trauma, who can maintain that healthy emotional boundary. Because if you're carrying that much pain and suffering, and you're coming into somebody to be vulnerable and to share that with somebody else, we also have to know how to manage that as well, and keep ourselves in a safe place, emotionally and mentally.
So this is another workshop I do. It's called Because I Care. And that's how I titled this, Because I Care. It talks about self-care, avoiding vicarious trauma. Right?
Man, that's huge.
Because one of the things therapists, and I had to learn this myself, and that's why I took a break, is that we are not super, I'm no different than my client per se, I have no superpowers or anything. I wish I had some. But
if you had a superpower, what would it be?
Travel, like flying, because I like to travel a lot. I love traveling.
What would be yours?
Mine?
Superpower. What would be your superpower if you could pick one?
Mine would just be like that transportation, like I want to go here, poof.
Like a time.
Yeah.
Like a time travel?
Yeah. Oh yeah.
Oh, that would be amazing.
I don't want to wait for my pizza to
I
be
would
made.
definitely fly.
Yeah.
I want to feel the winds, not the bugs. but just like the wind in my...
Don't fly with your mouth open.
Right.
No, but that's the reality is that we have skill, we have a good heart, we have knowledge that we apply, but we need to take care of ourselves. You know, we need to, because if you're not well, and this is a question my students ask me when I teach, they say, is it okay to cry in session? You know, and with my client, some of them, you know, well, it depends.
They don't know. If they've been told it's not okay to cry.
I said it depends. I said if you start crying and your client is crying, who's gonna be the stable person to regulate either of you?
You talking about the counselor crying?
Yeah, the counselor.
Oh.
Yeah, the counselor crying. I'm like, who's gonna regulate
Right.
your client? Because your client is there because they found a safety person, a safety net to be able to allow themselves to cry. And if you start crying with them, I always say, well, who's gonna regulate you and regulate the client now? Who's, you know? And so I said depends. And for me, personally, no, I don't cry.
Right.
I do feel, and I do like, okay, I need to go to therapy myself. I need to go to a supervision, or I can just go to hiking, which I love hiking.
Yeah,
you know.
Self-care.
But but the issue is that we are not Superman or Wonder Woman. We have to understand that as therapists, if we don't take care of ourselves, that's our primary ethical duty, to take care of ourselves to be able to serve others. Otherwise, you know, it'll be hard.
Yeah. You have to do your due diligence and make sure that you're okay to practice before you're treating anybody. I think that's such a good point for any other experts that are watching us. Check in with yourself too. Make sure that you're doing well. Because I like how you said it. Sometimes even us as therapists need a therapist.
I have my own therapist. I have to. I'll be honest.
Yeah,
I saw her last week.
Nice.
Yeah,
I have my own too.
It's part of me having. Now I don't see her every week or anything, but you know I
but if you do, that's okay.
Yeah. If you need
if
to,
you
do what you gotta do.
For me, it's maintenance. I have her for many years, just maintenance. So I go whenever I need to go. And
that's a nice stage to be in.
Yeah.
That's the goal, is the maintenance stage, and we can talk about stages of change another day with you guys, because that's so important. But anywho,
So essentially, you know, to kind of wrap it up, and we're gonna close out our live. Biggest takeaways, I think, from today, something that I really want to identify is understanding that if you have experienced a traumatic event, even if it was 10, 15 years ago, it's worth going in to see a professional to process that. Because even if it was 10, 15 years ago, 5 years ago, 2 months ago, however long it was, if it was not processed, it can manifest in your relationships and the way that you treat yourself as well.
Yeah, I mean, I was gonna say, if it happened 15 years ago, your brain, you'll be carrying it 15 years ago, right? So your brain's still there, and the memory is still there, underneath, but still there.
Yes.
So.
Yeah. I mean, it's memory on top of memory on top of memory on top of memory. That's a lot of unveiling.
Right.
That is a lot of unveiling.
And that's a lot of unveiling that professionals can walk you through. And make sure that that we can provide the type of therapy and the type of assessments that would be helpful for you.
Absolutely.
Right? So maybe we can wrap up with some coping skills or some effective self-care to practice. Because maybe even listening to this live was a little bit triggering for you.
Yeah.
There's some construction over there, but don't mind that. But if listening to this was triggering for you, what would be some self-care tips that you guys would encourage?
I would say do some breathing exercises. Oxygen is so important. You might say, well, that's everybody knows that, but we don't actually practice oxygen. We actually don't take the time to breathe. And I would just say also connect with someone that you trust and you care about, you know, helping you find resources.
Yes.
If you have any spiritual type of belief system, that's really important to help you balance your life, and you know and get a good night's sleep if you can.
Yes.
And get outside.
Yep.
Oh, that's fine.
You guys know that we promote movement.
Exercise.
Hiking.
Go to the pool.
Yes.
Go tan.
Yes.
But not too much sun on your face, because then that's when it's unhealthy.
Thank you so much again,
Dr. Vargas.
Do you want to look at the questions?
You're amazing. Oh, okay. I'm going to go up before we head out. Hi, Byron. A lot of children are stifled emotionally because they are not allowed to express themselves. We'll go through and we'll respond to some of these.
Well,
Responses.
Right now or later?
Yeah, we'll knock it out right now.
Oh.
What's your thought on that? We wrapped it up, but we'll go to like 2
well,
3 minutes.
Children will usually express behaviorally, not verbally. And this is word to the wise therapist. If you work with children, you must learn expressive arts.
Yes.
You know, play is the language of children. Anna Freud said that, not me. But children will express in classroom by being very active, very reactive.
Yes.
And it's a way for them also trying to find regulation. And so now, because they feel, and it's hard for them to express. So I agree with that. They don't are allowed to express in the way that they express. Unfortunately, sometimes it's not very constructive for them. And we try to tell them, sit down, be quiet, and pay attention.
Right.
And they're inside feeling all this, you know.
Yeah. And they don't know what to do with it.
Exactly. And so, expressive arts is really important for therapy.
Art, clay, if you're, you know, if the child
Yes.
really likes to do something with their hands, they like that tactile type of expression. Drawing, painting, clay,
Arts and crafts,
DIYs are going to be helpful.
puzzles. I've actually found puzzles have been really useful with
They're
kiddos.
coming down.
Mm-hmm.
The
Now you have to concentrate.
parasympathetic system gets activated.
Yes.
Oh man, man! I was gonna bring up the fight, flight, or
The
flee response.
sympathetic
Freeze,
system,
yeah.
parasympathetic system, yeah.
Yes.
Mm-hmm.
Gracias a todos. Keep up the positive work. Hay muchos mexicanos que sufren de mental health. Aquí en Arizona me da gusto saber a qué país ayudando a nuestra gente y otros.
Yeah, he trabajado con muchos mexicanos y algo que siempre me dicen algunos, yo no creo en esto.
Yeah.
Me dicen, en mi cara me dicen, I'm sorry, de esto.
No,
No, está bien, todo está bien.
Dilo en español.
Empecé
por
a hablar
favor.
en español. No pensé, y me dicen, yo no creo en esto. Yo no- y le digo, no importa, pero ya estás aquí, vamos a platicar.
Sí, ya.
Eso.
Es mi tiempo.
Sí, está bien.
Tenemos que trabajar un poco, you know. Y en la comunidad española no hay mucha discusión sobre cosas así, la trauma, la historia de trauma en la familia, hay cosas que está pasando que right, es separados, right? What is that? How you say out of sight, out of mind?
Lo ponen bajo bajo el tapete.
Sweeping it under the rug.
Rose, our homegirl Rose said that you, Dr. Vargas, you did a really great job at explaining things.
Thank
I
you.
like him.
Thank you.
Awesome. Okay. Well,
Wow. Well, we hope that you guys enjoyed this. Did you enjoy it?
Oh, I want more.
Dr. Vargas, you're really awesome. Thank you
you're
so
welcome.
much for.
Yes, you are. And thank you, Grand
Amazing.
Canyon University, for inviting us here
Yeah.
as well. Tune in next week. We always do weekly lives on Instagram, Facebook. We will be uploading videos to our YouTube channel at
Empower el Mundo.
And always remember, be empowered.
Live empowered.
Yes. Adios. Save.